This is ICD. We implant for the patient who is having the rhythm disorder, and this rhythm disorder for the patient who is having the high heart rate as well as the low heart rate, both the rhythm disorder it take cares. The most important thing which we have to know, we are getting implanted with the device, whether it is a MRI versus non-MRI, single versus dual chamber, and whether it is a Bluetooth or non-Bluetooth enabled devices. So if you're a Bluetooth enabled device, you can transmit the information to the doctor, and he can see and he can give the impression regarding the rhythm disorder if you are having, or you are having any symptoms, it can provide that information also. If it is a dual chamber versus single chamber, certainly the battery life is the important thing. Single chamber will be having a longer battery life than the chamber. And third is the home monitoring. So if your device is having a home monitoring, you can send the information to the doctor. These devices cost around 6 to 8 lakhs. If you are having a single chamber, it may be costing 5 to 6 lakh, and if you are going for dual chamber, it may be 6 to 7 lakh, and they are having a limited warranty 5 to 8 years. So choose the device after discussion with your doctor.